Live.
What's up, guys? John here. Titan Talk Tuesday. Very, very excited. So it's going to be a good rest of the week. Thank God. We're all ready to Wednesday tomorrow, which is hump day. That's right. So Titan Talk Tuesday. I love hanging out with you guys. What's going on, Punisher? My man. 6 foot, 420 pounds. How you doing? Big homie, NYC. All right, Tom Flo, 13. Drew Lynn, what's going on? A great day, G. How you doing? Chosen 777. I need to fix loose skin. We can definitely help you out there. Mara Mike, how you doing? Big Gant, 702 Muscle. What's going on, guys? Sick Vic, what's up, dude? Ocean, what's going on? Aaron, how you doing, man? Boreed, how you doing? Muggs in South Cast, how you doing, man? What's going on? Mia, Big Lou, what's up? What's going on, guys? F. Flynn, how you guys doing? We got a great show for you guys. If you guys have any questions about any of the therapies and any services that we do, we'll be more than happy to help you guys out. So, with that being said, we do everything and we service nationwide. So, if you guys don't know what we do here at Titan Medical Center, I'm just going to bust it out for you and go down the list. So, we do hormone replacement therapy for males and females. So if you're looking for low testosterone, females, it could be all different hormones too, as well as testosterone, estrogen, progesterone. Guys too, right? Because we want to make sure we're balanced hormones, a harmonic balance. We do medical weight loss. We have all different types of therapies for medical weight loss. From natural, like MIC and B complex, injectables. We have oral forms of some weight loss, like ECA Stack Plus. Our new Prometheus therapy, which is a great one. And those help in all different types of ways. We are going to definitely talk about Dr. Fauci today too, Profit. My man, how you guys doing? I hope you guys are doing all right out there in Louisiana. That's my dude, for sure. All right, so we're going to talk about these guys and talk about some of these things. Robert Clark, what's going on? Joey, what's up? So we do hormone replacement therapy, males and females. Medical weight loss, our custom vitamin amino acid injectable therapies like Hercules Potion, Titan Complete, Titan Ultra. We got all different types of ones like Titan Up. So these things will help in a number of different things you're trying to do, whether it's boosting metabolism, focus, energy, right? You want weight loss, or you want a great pump, recovery, liver protection, or detox. We can do that too. What's up, Sean? How you doing? So phentermine, we'll talk about that too, Drew, since you brought it up. So we don't do a lot of phentermine, all right? And let me tell you why. Phentermine is an FDA-approved appetite suppressant. And it's used by a lot of places out there. So let's talk about what phentermine is. Phentermine is basically a methamphetamine, okay? That's what it is. It's a controlled substance. Now, what phentermine is used for, or should be used for, is an appetite suppressant. So they give you this medication, and what it's supposed to do and what you're supposed to be doing with it is it's supposed to help curb the appetite so you can pick better food sources and smaller portions of food. So this will get you on your weight loss journey, right? Now, it provides some energy because it's like methamphetamine. Here's the bad thing about it. It's not a weight loss medication, okay? It doesn't do good for fat burning per se. It's great for appetite suppressant, but even that wears off because if you keep taking it, you build up a tolerance. That means you'll need to take more, right? And it's still not going to have the effect. And then people start using it as a crutch afterwards, which is not good either. You don't want to use this over time period because it's not going to have the good effect that you originally had with it the first couple of days you tried it. And it's not going to help with weight loss. There's people that want to go on it and it's like a crutch. And just, they need it to even get through their day afterwards. You don't want that. So with that being said, the alternative and way better alternative that we prescribe for a lot of our patients is our ECA Stack Plus. It's got ephedrine, real ephedrine, HCl, caffeine, aspirin, B12, and chromium. Now, ephedrine's great for weight loss, right? It's going to be awesome for energy, and it's going to help focus, along with caffeine, same thing. So these two stimulants are going to work together, and they're going to basically help out with those areas. Focus, right? Energy. They're going to help with weight loss, even if you're sitting at your desk all day. They're going to curb the appetite a little bit too as well, so that's great. And it also has B12 and chromium in it. And what these things do is help boost the metabolism naturally. They aid in weight loss, nervous system, a lot of these different functions that you want to include with the weight loss journey to help. You want to boost your natural system as much as possible. Let your body work for you. So with the conjunction of all these medications all in one little capsule, it usually gets our patients the result they're looking for. We talked to one patient last week. He lost 25 pounds in 3 weeks. That I'm not going to say everybody can do that, but this guy didn't change a lot of different things. He did eat a little bit better nutritional-wise, food-wise. He stepped up his activity to 3 times a week, which isn't a lot. That's nothing crazy. So it's nothing like you have to be in the gym 7 days a week and you have to eat perfect every meal and 6-7 meals a day. You don't have to do that, right? You don't want to have to do that because a lot of people can't do that. They just can't with their work schedule, with the family, everything going on. But listen, what you put in, you will eventually get out. And with these therapies, those expedite or help the result, okay? And that's what we are here for, all right? All right, so let me get to some of these questions here. I hope that answered your question about that. Hey, bro, from Portugal. Portugal in the house. What up, area? How you doing? Thank you for tuning in. I definitely have a voice. I'm definitely going to talk about this stuff today. I promise you. All right, Port Arthur, Texas. Sean Hussein, what's up, dude? Hey, I think I got your stuff going out to you, your package, your Titan gear. So we have all types of Titan gear, guys. I think I got that for you going out. All right, so let's talk about one more question. Eat right, train right, take Titan Medical Center Therapies. Perfect. How do you obtain therapies from out of state? So, if you guys are out of state, we service nationwide. The only state that we're not doing right now is Ohio, and that's because they've been all jacked up because of this pandemic. But every other state we can service. If you're from a different state, it's real simple and easy. If you want a blood test from us, you just call us up and text us. We'll set you up with a lab in your zip code. We can send you in. We get the results automatically 2 to 3 business days later, and you're good to go there. You fill out the new patient paperwork. You're on your way. If you want to get the vitamin amino acid injectable therapies, ECA Stack Plus, that doesn't need blood work. All you have to do is fill out the new patient paperwork. You call or text us after that. We set you up with an appointment with our medical provider. And if you're not in the state, you're out of state, you'll see them via telemedicine. Skype, if you do not have an Apple product, or if you do have an Apple product like I do, you guys can use FaceTime. And we see you, you see us. We go over everything for you. Then we can help you out with a custom regimen. We also want to ask you what your goals are so we can help you attain those goals. After that, you pay for your therapy package and it gets shipped directly from the U.S. licensed pharmacy to your doorstep wherever you're at in the country. It's real simple and real easy. So, Tom, if you want, just call or text us. We'll be able to help you out, okay? And we'll talk you through the whole process. It's real simple and real easy. Copeland, how you doing? Wendy Hall, what's up? Daryl, what's up? Robbie Franklin, how you guys doing? Let's get to the loose skin. I dropped 230 pounds 3.5 years ago. All right. So Chosen 777. Good question here. So how do we increase skin elasticity? So when you do lose a lot of weight, there is that negative thing, I would think, in the loose skin. Because you work so hard, you have it all off, and now you have this loose skin. So how can we help with elasticity? So one, you want to make sure IGF-1 levels are good. So like growth releasing hormone, peptides, those are really good because it will stimulate that and help with elasticity in the area. There's also some other things like our fat burning cream, which will tighten the areas. Now, that's not going to be a permanent result, but boosting metabolism and having these different things as far as the growth releasing hormone, increase IGF-1 levels. IGF-1 levels directly correlate with skin elasticity. And that skin elasticity is going to have to come back there. Now, sometimes that might not be enough. It just depends on how much, weight you've lost and how much skin you have. Sometimes there are surgeries that are needed for this, okay? It just depends on what your situation is chosen. And I don't have like pictures to think, I'm just going by kind of what you said. But usually it's in the stomach area where people want, they want the elasticity to come back. It's something you got to train, right? And you got to do things differently to get that elasticity back, and that's where some of these different therapies come into play. We can help you out. I don't know how severe the loose skin is, but we can definitely help in some ways. If not, we can definitely give you recommendations on what you can do outside of the clinic. Like I said, sometimes there is surgery that's needed. I have one person that's doing it where they lost 200 pounds almost. Like they were 400 pounds, okay? 400 pounds, lost 200 pounds. So it's a guy. So at that point, he's 200 pounds, but he has a lot of loose skin. He's like, man, I work so hard. I got all this off, and, I still can't go out to the beach and take my shirt off because, I feel embarrassed because of this now. He was embarrassed because he weighed so much and couldn't take it off then. And now he's done this awesome transformation, right? He's healthier, feels better than ever. And he's like, damn, my skin and just, I don't want to look like this either. And that was just, that's something that he had to do. He tried everything else. And I would definitely encourage that. Try everything else before you go to the surgery alternative. But some people, that's what they want to do. Okay. What up, Camilla? How you doing? Hunter Cock. What's up, Illmatic? My dude. How you doing? Happy Titan Tuesday to you. Cortez is Spartan. My guys out in Orlando always represent, looking great. Blake Johnson. What's going on? Brazy. Great product. Thank you. I appreciate it. Hulk Squad in the house. My dude, Illmatic. So new here, Wendy Hall, if you're new here, awesome. If you have any questions, or if you're already a patient, you even want to shoot them out, or if you're not a patient, you have questions on what we do and how we can help, please shoot it out. I'd be happy to answer that. I take TRT therapy and Imperillin. Had to get skin cut, but I still need to tighten and work out 7 days a week. Okay, so Imperillin's a good one, but like a therapy we offer, right? We put CJC 1295 and Imperillin together. It's two different peptides. And they both stimulate, the pituitary on the anterior, the front, and the posterior, which is the back. So it's going to work a lot better for what you're doing. And with that, if you're on TRT or HRT therapy, I don't know if you're on through us or whatever it is, make sure that your hormones are all dialed in. So what I mean by that, testosterone is what everybody focuses in on, especially with guys, TRT, they're testosterone. But you have to make sure the other hormones are balanced, or you're going to get some negative side effects, fat deposits and stuff like that, water retention, even with skin elasticity. So make sure you're all balanced out as far as that goes, all right? Michael Smith's in the house. Big Irishman, my dude. You're welcome, Chosen77. I appreciate you tuning in and everybody else tuning in. What's up, Stacy Sullivan? My man, big ups to my man, Hulk Squad and Big Irishman, always tuning in. Same here. I appreciate it. John True, what's going on? I love that. Taking stimulate along with HCG affects fertility. So, all right. So when we say taking cypionate along with HCG affects fertility, so it would affect fertility in boosting it. Maybe Sean Hussein, it's not going to decrease fertility. So what I mean by that, if you're on HRT through Titan Medical Center, you're going to get 3 medications as a male. That's going to be testosterone to replace or optimize the testosterone that you don't have to make sure that gets up. The next one would be an estrogen blocker to make sure when testosterone aromatizes in the body, and it will, it usually goes into estrogen, estradiol, specifically we want to adjust and make sure it's good, and DHT, which is dihydrotestosterone. You're also going to get HCG. The reason, HCG helps mimic the signal from the brain to the testes. When you take testosterone from an outside source, whether it's injectable, it's a cream you're putting on, sublingual, or a pellet, what's going to happen is your brain is going to pick up on that. Your body is amazing. It's the best machine ever made. What's going to happen is it picks up on this testosterone, and it sends the signal back down the testes and says, listen, we don't need you to work anymore. You can shut down. So what happens is that signal gets cut off. The testicles will shrink and low semen production happens. Plus, tightness of the testicles is not comfortable. Trust me, I've been through it, I know. And with this, you don't want low semen production. Now that's where the myth comes in with fertility issues and testosterone. It doesn't cancel out fertility. It doesn't make you infertile, but it lowers semen production, which if you're trying to have babies or a child, you want as much volume, right? And you want to shoot as much as you can. So if, you don't have anything getting produced in there, it's going to be hard to produce that volume, and you want as much as possible. So HCG will make sure that it mimics the signal to your natural, your testes to keep on your natural production, to make sure there's no shrinkage, and to make sure semen production does not lower, it actually increases. So this is great, okay? So I hope that answered your question, Sean.
We got a couple comments on Facebook as well, John.
What do we got here?
Can you read that real quick?
Yes, Ultimate Health Bible. Mike Neal, my man, what's going on? All right, so is that Diane? No, it's Glenn, right?
Yeah, Glenn versus cost.
All right, Glenn, cost of labs. So our labs are the most inexpensive in the whole country. We beat everybody. I don't care where you go, what you do, discount codes. We beat everybody. So for males, it's usually $200 for our full panel. With you guys getting the discount from me or one of our different ambassadors out there, it's $150 for the full panel. Now, here's what you got to look out for. And this is what, somebody that really doesn't know what they're doing or doesn't know the medical field, they're like, okay, full panel. So our full panel and somebody else's full panel could be totally different. They could call it a full panel. But it's really what the test that you get in the full panel that matters. Okay? Because you want to look at a lot of different things. So don't go by what somebody says, we do a full panel for this, and we do a full panel for that. No. What tests are included in the full panel? And that's where we beat them apples to apples all day long. And that's what some of the different things. Ours is very in-depth, and you want to look at a lot of these different things because they all correlate. Everything works right alongside the other. Okay, so you want to make sure everything is working properly and everything's in a harmonic balance. If you put too much in one area, there's going to be breakdown in other areas. You don't want that, okay? So $150 for the guys, that's with the discount. Females, it's usually $300. It's $200 with the discount that I'm giving you guys. And the reason that it's a little bit more expensive, you females are a little bit more difficult, and we got to run some more tests on you guys. Okay, guys are a little bit easier to dial in. Females are a little bit harder. But listen, we want to make sure that we're getting you guys optimal results, and we're making sure we're covering all the bases. Because if we're not doing our due diligence, and we're not doing you right as the patient. Okay? There's a lot of places out there that don't do right for the patient, and they should. All right. What's up, bro? Hope all is well. His wife all better from COVID. So my wife did have COVID. I had COVID, and my son had COVID in June. I was totally asymptomatic. My son was totally asymptomatic. My wife was in the ICU. She's still one of those long haulers dealing with some of these negative symptoms that are still going on neurologically. Dizziness, swelling of legs, like crazy stuff, right, that she never had before. So she's still dealing with that, but she's about 90% better, back to herself. Energy's there. She lost all the COVID weight because she was taking a lot of steroids. They had her on tons of steroids. And I'm not talking about anabolic steroids. I'm talking about cortical steroids. And cortical steroids can put weight on you. That's just what they do. They help with a lot of different ways and very effective, but they can help, put that weight on you that you don't want. So she got all that weight off, thank God. And, she was healthy before I got her, in the lifestyle and healthy when I met her. It's been better every year, but this is taking it to a whole different level. She's eating a lot better. And she ate good before, but listen, Sharice just looked beautiful. I ain't going to lie to you guys. So I don't care if she's in a trash bag. She gained 20 pounds. She still comes across. Some people just got that, they've got that aura, right? And it projects. I don't care who they are. So she just got that. So she's doing a lot better. I appreciate you asking. Thank you. Not yet. Need more energy. Pre-workout is not working at all. So that's the problem. So let's talk about that. So ECA Stack Plus, ephedrine, caffeine, aspirin, B12, and chromium. It's going to replace your pre-workout. All right. Now, pre-workout consists of a couple different things. One, the pump factor. You want nitric oxide, so your arginine, citrulline, ornithine to help you work out longer. But people usually use pre-workouts for stimulation. They want stimulant factor. The problem is, when you're taking pre-workouts, if you look at the serving size and what you're taking in one serving size, it's usually between 300 and 400 milligrams of caffeine per serving size. And there's all these other garbage things in there, weaved in there. But we want to specifically look at that, because what happens is people start taking that daily, and then they start building up a tolerance. And then they have to take more. And the tolerance goes up, and they have to take more. Now, I know some guys and girls that are taking 2-3 scoops of pre-workout when they're only supposed to take one serving size. You're talking about upwards to 800 to 1,200 milligrams of caffeine daily in one smooth move, right, when they're taking it in. That's not good. You're overdosing on caffeine. You're building up a tolerance that's going to be very hard to come down from. You're going to have to take a break for a while to get that back to where it needs to be, to reset per se. With the ECA Stack Plus, you won't have to do that. It's going to help you along with that. Now, if you mix that ECA Stack and Hercules Potion, you have the perfect pre-workout. ECA Stack Plus is going to provide the stimulation, weight loss, focus that you want. And then Hercules Potion is going to provide the pump, recovery, longer workouts, and more strenuous activity, liver protection on that hand, proline, which is collagen-based amino acid to lubricate the joint areas, L-carnitine for weight loss is in there, NAC is another one for as far as liver functions. So getting those two together, you're going to get a great combination. You're going to look exactly what, or going to be getting exactly what you're looking for, okay? Woods, how you doing? Blue Magic in the house. 84 HPO, how you doing? Michael, what's up? Hall Squad, my girlfriend just sent her blood results into you guys. Can't wait to see you guys can do for. I can't wait, Hawk Squad. I love this. I love helping couples, especially. I do it all the time, especially the last couple of weeks. So we're training some new girls in here, some new staff members. And, it's hard because I don't care if you're in the medical field or not. What we do is special, is specific. A lot of our different blends, as far as Hercules Potion or Time Complete, no doctor has never heard of. They're not really into supplementation or amino acids or vitamins. They're more Western medications prescribed, like, antibiotics or cholesterol medications and stuff like that. So they have to have, really in-depth training. So me and Sharice want them to actually, or to hold the Titan standard and to be educated about what they're talking about. Why would we put somebody on the phone that wasn't educated about our therapies to be able to explain to the patient exactly what they do, how it's going to help them, and what's the best the best route for them or the best regimen for them, right? And the medical providers provide that here, and then our staff can back it up. But, at that point, usually when I get on the phone, I'll start talking to either a guy or a girl, and I go through everything with them, and they have questions, and they want to sign up. And then they ask, can their significant other sign up too? And of course, because what happens usually is this. If one person signs up, let's say it's a guy, and the guy has low testosterone. The guy's 40 years old per se, right? He gets on testosterone replacement therapy, energy levels start going up, metabolism starts boosting, starts looking better, starts feeling better, libido is going to go up. So then he's ready to go. And, and then listen, the wife's 40 years old. She might be going through premenopause or something like that. Hormones might be deficient. At that point, she's not feeling the same way. And she's like, man, I want to feel like you. So what do I have to do? And that's when they usually sign up, and we get them right along and optimal. And then they're together, and they are enjoying life and quality of life better than they were before, which is awesome, right? I mean, we love to hear those stories. And we get a lot of people, that I love the positive feedback or the reviews. People write, and it's like, man, we really helped these people. It's like you really, truly help somebody. And it's priceless. That feeling is better than any money that we've ever got or anything like that. Success-wise, it's always the best when we can really hear these stories from our patients, because it really does affect their life day in and day out, which is awesome. All right, Big Irishman, always repping Titan Medical Center. I know you are, dude. I got some new clothing coming out to you, too. Girlfriend, T4 and free was 1.1. What does that mean for her ranges? So I'll have to look at it. Let me just look at the reference ranges. Did she get the labs done in a LabCorp or Quest? We'll have to figure that out too, because different reference ranges, and that can be different as far as the result. Pack Animal Fitness, my man Matt in the house. If you guys are in St. Peter's, or excuse me, what's that, Brandon area? It's like Brandon, right? St. Pete?
Yep.
All right, so St. Pete, if you guys are in St. Pete, Pack Animal Fitness, go check out my man Matt. Mention Titan, go check out the gym. This guy's put his heart and soul in it, so big ups to him. He's always, welcome Titan in there, so we love that. We appreciate that. So we got to show him some love. Great gym for lifters, man. You want to go check it out, please go check out Pack Animal Fitness, and you're in St. Pete, you're coming in. Camila, all right. I'm 215. I need to lose 50 to 60 pounds. My energy level is so low, I always feel tired. Not sure if it's because I work overnight shift. Do you have any suggestions? Absolutely. So my first question is age, and then if you're feeling these different things like this, right? And then has the weight gain been continuously steady, and has it been over a long period of time, short period of time? So we really get in depth of these questions because we want to find out. It will help us in helping you. And with this, I would, if you're saying, listen, I'm 30 years old, right, or late 20s, and I'm having these issues, you might want a blood test just to see where everything's at, because that could be the problem right then and there, especially being tired, gain a whole bunch of weight. This is usually a common thing. For females especially, you guys are more estrogen prone, and usually estrogen is really, really high in some females. And what does that do? It packs on weight. It does. High estrogen levels that's where women get, more boobs, the stomach, the thighs, the glutes, the ass, excuse my language. And then guys too. So if we have high estrogen levels, so if you're on testosterone alone, right, and it's converting to estrogen, what it does is it creates more tissue. It grows tissue. And that's where gynecomastia or man boobs come into play. And this happens over time. It doesn't happen overnight. And that's when people wake up and it's over time. They look at themselves in the mirror, oh my God, what happened? And then when this does happen, especially guys, there's no way to inject or get it out of the system. You have to do surgery and get it cut out. You don't want to do that. So for Camilla, I would look at possible blood testing. If you want a quick fix just for energy and focus and to lose weight, ECA Stack Plus for sure. It's a lot of bang for the buck. It's our most least inexpensive therapy as far as that goes. That's very effective. That might be a way to go. But we have all types of different things that can definitely help you out. We have a lot of people that work these late night shifts, overnight shifts. I have a lot of people in the bar and nightclub industry, especially in Tampa. Some states are closed down. We're wide open pretty much. So they have these long shifts. And I always talk to them because they're dealing with a lot of people too, right? You want to make sure the immune system's boosted. And, when you don't get a lot of sleep, it actually runs down the immune system, right? So that could be a different problem too. So please just contact us, 727-389-3220. Our phones are closed down, so they'll go over to the recording, but you can text us. It comes right to us, the exact same number, and we can get back to you today or tomorrow. All right, Sean, no problem, dude. I can't wait. I can't wait for your results. One life to live. My man Antonio just got back from Tulum, or is he still in Tulum? I don't know. I hope he's living his good life out there. All right.
Same question from Dwayne Dade there.
Where are we at here?
On the bottom right, bottom.
Costa Labs.
Right here.
I'm watching Facebook now, Glenn Parsons. All right, Herb Beasley. Aaron Reed. So Aaron Reed, I do know. Aaron Reed used to live here in Tampa. The dude is a monster. I think he's like, 6'8" or something stupid like that. Really lean. Just a big white dude. Aaron Reed's a big white dude, man. Love him, dude. Great guy. He's out in California right now. I don't think he's liking it out there too much. All right, so love Titan, my man Dwayne Day. I appreciate you. Your Prometheus is on the way to you, dude. So you let me know how that therapy works out for you. All right, hey Dwayne, thanks, buddy. All right, hey, just wondering when this pandemic gets under control, would you guys try to get some vaccines in just in case every year you have to get a shot, and would you ship it out to the U.S.? So vaccines, let's talk about this. All right. I'm 50-50 on these vaccines. And let me tell you why. All right, I've already got COVID. A lot of people have already got COVID and they've got over COVID. So I'm still healthy. I have no problems after this. A lot of people have got COVID and gotten over it and don't have any problems afterwards. So that means you're a healthy individual. The common cold, we don't get a vaccine for. I've never got a flu vaccine, right? So at that point, I don't really like the vaccine. I'm just being honest with you. I think that some people need the vaccine. These high-risk people, they're older people, get the vaccine. Don't take any chances because a lot of people have died from this damn thing. It's nothing to laugh about. It's not funny. I see it on Facebook. Some people think it's a joke, and all this. It's not a joke, especially if you have somebody in your family or somebody personally that's been affected by it. At that point, now listen, if I caught COVID by myself, I wasn't married, and I went through it totally asymptomatic, no problems, I would think it's a joke a little bit. I'd be like, listen, this is not a big issue, not a big problem. But like I said, I've been affected directly by this. And I know other people that have died now. I know people that I know personally have died from COVID-19. So I don't think it's a joke. I know people that had to relearn to walk getting COVID-19, which is really crazy. So it's really different. So those people, I think, should get the vaccine. Do I think that everybody should have the vaccine? I'm kind of in the air about that. I think we're almost close to herd immunity without it. With the people that get the vaccine now, and with everybody that has caught COVID-19, I think we're be on our way to herd immunity real quick. And there's doctors out there that have spoken out against the vaccine. Obviously, they want us to take this vaccine. They're doing everything they can. Even for Super Bowl, they gave 7,500 free tickets away to healthcare workers that got the vaccine. So they're really pushing for this thing, and there's a lot of people that are skeptical about this, and even minorities. They're very skeptical about this. And the reason they are is because the Tuskegee experiment. So Tuskegee, thank you. Tuskegee experiment. And this ran from 1932 to 1972, 40 years. And what they were promising these minorities was that they were going to give them free health care. And they weren't. They weren't even treating it. They wanted to see how syphilis, untreated, affected people. That's really messed up, and that's really, really scary that we would even do something like this. So I don't hold it past these companies or anything like that. And Moderna, they have the hands in all kinds of biotech before this. So listen, I'm not a conspiracy theorist or anything like that. I think that some people should definitely get the vaccines, and I think it should be a choice to that matter. If you've already caught COVID-19, if you've got antibodies, we should be testing for these things and seeing what's going on. Okay. So Dwayne, listen, we will probably get the vaccines for patients if they want to get them, because we do vaccine shots too. So now, as far as us shipping vaccines, I don't know the legalities of that yet. I've never asked to ship a vaccine and stuff like that. They're supposed to be administered by healthcare professionals or pharmacists. Now they're even going to go to the dentist, which are healthcare. That's healthcare still. So at that point, I don't know. Daddy Shaq, what's going on, man? Duff, how you doing? Up Psycho Creations, how you doing? See Birdman, M Villa. Does it after your heart? Does it after your heart? So Daddy Shock, what does it after your heart? Let me know what that is. Aaron Harrison, Mama Mina, how you guys doing? Do you guys have anything for NOx to help with BP? NOx. Form of NOx. What is NOx, Mahir? I'll answer that question for you, Mahir, Mike. So one thing that helps with blood pressure is tadalafil. And tadalafil is used for BPH. It can be used for ED. It can be taken daily at small little doses to help with both these things. That's a definitely good one. Does ECA stack affect your heart? Good question. So ECA stack plus, and it's got ephedrine and caffeine in it, which are stimulants. So if you do have a cardiovascular issue, you've had multiple heart attacks, stents, bypass surgeries, anything like that, you're not going to be a good candidate for ECA Stack Plus. And that's what our medical providers are here for. When you're in your consultation with a medical provider, they're going to go over all your history, your health history, your family history, all your symptoms, your goals, and then go over some of these different therapies that are going to help you guys. If you don't have any heart issues or crazy, outrageous blood pressure numbers, ECA Stack Plus is going to be very helpful, and it's not going to have negative side effects as far as damaging the heart. Now, some stimulants out there or some underground black market medications can definitely damage the heart and nervous system. That's another reason why we don't do phetermine. You have to take an EKG to get phetermine because it can affect the heart. And at that point, the nervous system and a lot of other different things. And that's why you cannot be on it forever and you have to get on and off. That's not good either. So that's a great question, Daddy Shock. I appreciate you asking that.
Mahir was asking about nitric oxide.
Nitric oxide. So yes, I thought that. So nitric oxide is great for blood pressure as well. So let's talk about that. Nitric oxide. Love nitric oxide. That it helps with blood flow, right? Vasodilation. So let's talk about it. So nitric oxide. So with nitric oxide, the best thing that we have is Hercules Potion by far. And that includes, specifically, the arginine and L-citrulline are injectable in there. So with this, those are both precursors to nitric oxide. They vasodilate the blood vessels, and what that does is increase blood flow, and that increases blood flow everywhere. It helps with blood pressure. It helps with cardiovascular. It also helps, guys, with erections. So you'll have a lot better time down there as well. But it's great for health, and it's great for blood pressure. So that is a great question. So we do have that. We even have our sildenafil, which is the Viagra, right? It's the main ingredient of Viagra. And we have arginine with that, which increases nitric oxide. Now, tadalafil is good too because that helps with blood flow and lowering blood pressure. You can take that with Hercules Potion, which is going to increase more nitric oxide. So great question. Chosen, is what an injection? Lee Bryce, what's up, dude? How you doing? Christian, Straight Guys, what's going on? All right, so with us, we don't take any insurance. Let me tell you why, okay? Because that question does come up a lot, and it's a good question. So we don't take insurance for two reasons. One, they can restrict the doctor and what he wants to test for or what he can prescribe to you. That sucks. We don't want to do that. We're not working for an insurance company. We're working for the patient. We're working with the patient. It's our medical provider's decision about what he wants to do or she wants to do to look at what's going on inside with blood work and what medications they want to prescribe to you. So there's no restrictions because insurance companies, they handcuff the providers. Just so you guys know, that's what goes on for real. Because the providers have to produce a diagnosis code for blood work, which we don't do because it's out of pocket. We can run any test on you we want. We know exactly what the price is going to be. With the insurance companies, and let's say a medical provider, a doctor wants to write you the blood test, right? And you go in there, you pay your $25 copay, you wait for half an hour in the outside in your car or socially distanced inside. You have to go back to the room. You wait another 15, 20 minutes. You talk with a doctor or a medical provider, which nurse practitioner or PA. You tell them the problems and they try to run you the test. Then you have to go to the lab. You check in with the lab, do the lab work. And then what happens after that, they could kick back this bill on you and it's at full price. If they don't think that it was necessary, that's what they do. And to get the results, you have to go back in, schedule an appointment, right? You have to wait another 25, 30 minutes, pay the copay, then go back and then get the results, have them go over with you. So we're more expedited and it's a lot quicker as far as that goes. So Camilla, 42 years old, I would definitely check blood work. You know, at 30s, we know decline, deficiency in hormones is a big thing. And at 42, definitely I would check out blood work. For sure, 100%. Hormones could unlock some of the different keys to, to the problems that you're having right now. And it could definitely help with weight loss effect, for sure. Energy, for sure, 100%. So this could help you feel a lot better. Quality of life, day to day, right? You want that to be good. You shouldn't have to wake up being tired all day. You wake up, and I know a lot of people are like, man, I got 12 hours of sleep, and I feel like I didn't sleep a wink, man. I just have horrible sleep. There's a reason for that. It just doesn't happen. Think about it. When you're growing up, you're a baby, you're in your teens, even early 20s, you're probably sleeping pretty good still. It's when you start getting older, when you start having the sleeping issues. And usually it's two types of people. One, they can't go to sleep. Or two, they fall asleep and wake up every hour on the hour. And they're like, damn. And it's just interrupted sleep. You don't get that deep REM trans 5 sleep. That's what your body needs for repair, for energy, for all these different things that happens. So you really want that good sleep because sleep is important. Immune function, a lot of different things. Everything goes together, but you need these foundations as far as activity. You need sleep. You want a good nutritional plan. Those are the 3 pillars of the foundation. You need those 3 things. Everything else, you can stack on therapies, your activity, all that good stuff. All right. Weight gain, long period of time. So, yeah, I would definitely look at hormones because that's what it sounds like. Dwight Tainsley, I just have a question about testosterone. My doctor has me on the same testosterone now for 11 years, and it just does not seem to be working. I'm tired and fatigued all the time. What should I do? All right, so I've been on testosterone for over 11 years now, okay? And you can change up the blends. See, this is another thing. When you go to your primary care doctor, they usually send you in, and it's usually just regular cypionate. We have all the esters. So we have propionate, which is fast-acting, enanthate, which is longer-acting, or cypionate. We even have blends that combine the maybe 2 or 3. That could help. Now, when you're saying you're still tired, your dose could be why. It could be too low of a dose. That could be it. There could be other hormones that are off. Are you checking estradiol levels? Because if you have high estrogen, you're going to be lethargic, and it happens over time. So this is another thing you want to look at. So that's really what I would look at. I would look at those things first. Look at your blood work. Look at free and total testosterone. Some doctors only want to run total. I don't know why. And the reasoning of running both. Let me break it down in layman's terms. You got a total and you got free. Total testosterone, free testosterone. Your total testosterone, think of it like a reservoir. It's holding all your testosterone in it. Then you have your free testosterone. That's pulling from the reservoir and getting utilized throughout the body. So you want to make sure those are both good. Those should both be optimal. And then we look at estradiol for a male. If that's high, you're going to be lethargic. You're going to be sensitive. You're going to have fat deposits, irritable sometimes. You could be crying during frisky commercials or sad movies. You're like, why am I doing this? You start thinking about it. Like, this ain't like me. Like, what's up? That's the reason why, okay? So that could be your fatigue for sure. Huge thank you to Titan Medical Center. Thank you, Shank Addicts. We appreciate you too as well. Thank you so much, man. Got all that, Camille. Yeah, for sure. Like I said, if you want like a quick fix, ECA Stack Plus is going to help with energy, focus, and with some weight loss. But if you don't want to put a bandage or a bleeding wound either, you want to definitely fix the root of the problem if there is a problem. That way, you can add the ECA Stack Plus on and just get, an extra zoom. But you want to naturally be able to wake up and not be so tired, because even if you have a late shift, your body's on a clock, so it adjusts. So if you're on this night shift, for months and months, it's going to adjust. It's going to say, listen, we need to stay up at this time and we need to go to bed at this time. The only things that affect that can mess up the clock is sunlight. Because usually, in dark spaces, that's when you can go to sleep. So make sure that you're in a dark space too, because sunlight can actually make you stay up. Looking at your phone, not on the night function or whatever it is, can keep you staying up too as well. I've had that before in the past. I'm on the ECA Stack Plus and AOD Peptide. I love it. Feel great. And losing weight. Big red. I love it, man. So that's awesome, dude. I love hearing that. And ECA Stack Plus and AOD, that's another killer combination, man. AOD, advanced obesity drug. That's a great peptide and works very, very well, especially with the ECA Stack Plus. You're getting all the benefits there. So I love hearing that, Big Red. Good work, man. Big shout out. I got a friend that I recommend that's doing their consultation tomorrow. John True 9. That's him. That's awesome. Big Irishman recommended me. Big ups, dude. Awesome. All right.
A couple from,
what do we got for Facebook?
YouTube, actually.
YouTube. What do we got here?
Just a couple right here.
Are we hiring? So we are hiring. It just, we're looking for some specific positions. If you want, you guys can always send your resume to titanmedicalcenter@gmail.com and we can look it over. And listen, if we think that's a good fit or we want to do an interview, we can do that. All right. And all right, if you had to choose one, TB500 or BPC 157, what would be better for tennis elbow? Great question. What would I pick out of the two? For me, it would be BPC 157 for golf elbow or tennis elbow. The reason why I say that is because originally, years ago, when BPC 157 first came out from the pharmacies for human use for us, we could use it. I had golf elbow and tennis elbow at the same time on this arm. You can go back to the videos because I have them all on social media and you'll see this big black brace on my arm. And man, it hurt like a son of a bee. And at that point, what happened was I used the BPC because I was still up in the air about it, and I still am. I'm standoffish from new therapies and stuff like that, or peptides, or some of the different things that come out. I obviously want to see the clinical research behind it. 2, I'm going to try it for myself. I want to know that it works because we would never recommend here something at Titan Medical Center that me or Sharice have not taken, right? And we know it's going to work because it's just going to look bad on us, and it's our name on the line. So I'm not doing that. So anything that works, I'll tell you. If it doesn't work, I'm going to tell you, hey, listen, this doesn't work. Or we're not even going to offer that therapy because if it don't work, there's no reason to have it. But BPC 157 worked tremendously for tennis elbow. And here is a trick. So tennis elbow. How do you get tennis elbow? That's right here. That's where you feel it right here. It's like in your forearm. You're like, push down. If you put it on somewhere, it's hurting real bad. So what happens with that? So usually it's in your grip. Strengthen your grip and you will not get tennis elbow as much. When you're lifting, get the wraps. They wrap around your wrist. You won't get tennis elbow again. I promise you. And honestly, I used to get it all the time. With wraps, no more. And like I said, strengthen your grip. You can get with the grip strengtheners. You can just do that. That'll strengthen that area for you too as well. But the wraps will help just as much if you use them. Okay? All right. My man, so he's bringing more. Big Irishman. My dude from the deserts. I love it. New Mexico, excuse me.
We got a 15-minute warning, John.
Oh, man, we're already 50 minutes. All right. So is your programs affordable? So yes. Now what would you put on a price for your health or some of the goals you're trying to hit for weight loss? I mean, a lot of people for weight loss, especially if they want weight loss, it's really, really hard for them to do. They have to, go to a surgery or stuff like that. So, you put a price on your health and put a price on your weight loss, or another goal that you're trying to reach. For us, now listen, for the weight loss, ECA Stack Plus, it's very affordable. We're talking about $100 to start for a month. At that point, everybody I think can do that. When you start getting into, more therapies and stuff like that, it's going to be more expensive. So it just really depends on what you're trying to do, all right. Does insurance cover anything? So no, we don't take any insurance, guys. It's either with insurance, you're all in or you're all out. You cannot do half and half. It don't work that way. They'll come back on you for double dipping. We don't do that. So I'm sorry. Unfortunately, we don't take any insurance. But that is better for our patients because, you can't use your insurance card for the thing, but you're not going to be restricted in what they can do for you as far as treatments either. So, and insurance doesn't cover vitamin amino acid injectable therapies. They don't cover like ECA Stack Plus, like weight loss therapies and stuff like that. They just don't do that stuff. It just is what it is. So, unfortunately, we don't. Peptides, they definitely are not going to do either. All right, DC Baker. And with like TRT or HRT, let's talk about that. So if you go into your primary care doctor and you want to get HRT or TRT covered by insurance, this is the thing. With a total testosterone range for a male, I'm just giving this an example, the reference range is 264 to 916. So whether you're 18 years old or 50 years old, if you're between 264 and 916 on a LabCorp reference range, you are normal. You're a 21-year-old guy at 264. You ain't going to feel too good. And if you're a 50-year-old guy, you're feeling like a 50-year-old guy probably should because you're at the lower end of the scale. Now, unless you're clinically deficient underneath that number, they cannot do it. So at that point, people just feel like garbage. Like, man, they've had to go through all these hoops and doctor's appointments, co-pays, blood work, all this, and still no help. So, that's the thing. We're going to be able to help you guys. All right. Yep, Hulk Squad, Hercules Potion, nitric oxide, definitely way to go. True statement for sure. Thank you for all the information. Not a problem. Shout out to Big Irishman for recommending the Titan fam. I can't wait to get out of the therapies and better my body. John, I can't wait to help you, dude. Anything we can do to help you out, let me know. Make sure the girls send you out a free shirt, man, when you go through your appointment, all right? You're going to love the therapies for sure. What type of testosterone do you guys prescribe for TRT? Good question. So we have all of them. We have cypionate, we have enanthate, we have propionate. We even have different combinations. Some that have all three in them, some that have two in them. So we really personalize the regimens for the patients. We want to get them results. We want them to feel good. That's what it's all about. That's why they come to us. That's why we've been so successful in 9 years of being open. We've grown substantially every year. We help a lot of patients out around the country, from average Joe to pro. Okay, so we can help you guys out, not a problem. Nikki! So our little Nikki, she's new in the office. Well, newer, I should say. She's not new anymore. So she's getting those therapies out. So you might talk to Nikki on the phone. If you do, make sure you guys are nice to her, okay? Do we take flexible spending? So HSAs and FSAs. Yes, we do. Now I will answer that question. Now, the thing with that, Mr. Reed, I want to be very transparent with everybody, because I am. I want you to check with them. Just make sure that they don't want any diagnosis codes. They shouldn't, because your insurance covers what diagnosis codes are produced, right? And FSAs and HSAs are supposed to be supplemental for things that are not covered by insurance. And that's where we usually do come and play. So just check with them just to make sure. I don't want you to have to, go through us and you have all these different things and then they're like, oh, we're not going to cover this and you're going to have to pay for this out of pocket. I don't want you to be like, oh man, Titan told me. Well, I don't want to be like that. I want you to check just to make sure. But yes, we do. So if they say, hey, listen, no, you can spend it on whatever you want. No problem. No diagnosis codes needed. We'll help you out. Not a problem. Okay. Thank you. You're right. I've been feeling very moody and not myself. So Dwight, I'm telling you, man, make sure those things are dialed in, and that's a common problem. A lot of doctors, primary cares, are not educated in hormone replacement therapy. They're not educated on balancing hormones. Even endocrinologists, and they're supposed to be specialists in this. So when these doctors go through med school, they literally have like a week, and they get taught on basic hormones. Testosterone, like estrogen, like this is what it does. Not to balance them, not to replace, nothing like that. So definitely want to do that. Okay, and these primary, it's not. They just think, oh, we're just going to replace testosterone, and you're going to be fine. That's not it. When they do one, it's going to mess with other hormones in the body. Like I said, testosterone converts, and it converts into different hormones, right? Specifically estradiol, which is E2, and DHT, dihydrotestosterone. I want to look at both of those. And 1 ml a week. So with that too, the big thing about that is you take your shot on one day, okay, and you start feeling good the first couple of days, and then in the end, the last couple of days, you don't feel as good, right? You're like, man, until your next shot, and you start feeling better. Then it's like an up and down, roller coaster, up and down. The problem is the way that they're having your protocol and dosing. So instead of 1 ml one time a week, you should split the dose evenly. And for us, like it's a Monday, Wednesday, or Tuesday, Thursday. And that way you're up, you stay up, and you're even keel. There's no up and down. There's no up and down. You don't want that. I'm telling you guys. You're putting your body through more shock doing that. It's have it up, stay even keel. You feel consistent every day. And that's what it's all about. What does it cost them to set an appointment to come in and to be evaluated? Okay, so blood test would be the first thing, $150. If you do a consultation through us, and it's for hormones, it's usually $150. Now, that $150 medical consultation, that covers you for 6 months. In the regards, if you have any issues, you need to talk to the medical provider again. You need to go on a video conference for the medical provider. In that 6 months, it's free. So we basically cover you guys for 6 months if you need to see the medical provider. And we're not going to charge you every time. You're not going to be a problem. Other places do this. You know, it's real cheap to start off, and then you start throwing the extras, the fees, extra. I'd rather just be very upfront, very transparent with people. They know what they're getting into. They know what it is, and there's no misconception about things. That's the way I like to be about everything that I do, especially in this. All right, Sig Vic, my man, including blood work, costs of BPC. So with BPC, you don't need blood work. So the healing peptides like BPC 157, TB 500, AOD 9604, are ECA Stack Plus, MK 677, CJC 1295 with Imperellin, Hercules Potion, Titan Complete, Titan Ultra. All these, all you have to do is fill out the new patient paperwork. You're going to see the medical provider. And it's a little bit cheaper to do that too, because we're not going through blood work and hormones and stuff. So at that point, it's $75 for that consultation. And that covers you actually for the whole year, if it's just vitamins, aminos, or peptides. If it's hormones, you have to do it every 6 months. We want to make sure we're monitoring you in blood work. We're monitoring you and what's going on. We're making sure every month we're checking up on you guys. Plus, if you're with Titan Medical Center, you guys are family at that point. And with us, we're not like any other doctor's office or clinic around the country. You can call or text or even email. You're going to get a response right away, and you're going to be talking to a live person. When our patients get text messages, that's not some mass text message that goes out or some bot. That's an actual person writing the message and having the conversation with our patients. If there's a problem, an issue, you guys can call the next day and talk to us and get an answer right away, or get on the phone with the medical provider. And places aren't going to do that. They don't do that. Think about the last doctor's office you went to and try to call in just to ask a question, or even call them back because they wwere calling you for something. And how many hoops you had to jump through and how long you had to wait. That's horrible, dude. That's not how it should be. That's why me and Sharice, we created Titan, because she was in the medical field for so long. I think it was 12 years at that point, and she worked in every kind of practice you could possibly go into, from nephrology, which is kidney specialist, to pediatrics. She did plastic surgery. She's done regular general doctors, so seen it all as far as a general practitioner. So she's been it all, and that was the big thing. People had to wait forever. They didn't get all their questions answered. They usually give you a short amount of time, 10 minutes in and out. So if you have a problem, what's that problem? We're talking about that problem, nothing else. If you want to talk about that problem, schedule another visit. We'll talk to you then. So we don't do that like that. We want to make sure we're taking care of everything for you guys. How does weight loss therapy work? So it's real simple and easy. For weight loss therapy, you guys are going to fill out the new patient paperwork. You'll send it in. You'll get on the schedule with the medical provider for your consultation. And if you're not in the state, you can do it via FaceTime if you have an Apple product, Skype if you don't. We're going to look at you as far as the medical doctor or provider. It might be a nurse practitioner. They're going to go over all your new patient paperwork, your symptoms, your family history as far as health history, your health history, and provide the regimen that would be best for you. Okay? So what do we got over there? We got anything else over there?
Yeah, we got a bunch. 5-minute warning though, John, just so you
Sure. I got 5 minutes, guys. I didn't get to go over any of my topics today. I'm sorry, but listen, I think this is more important to go over these questions with you guys. Do you guys give HCG with testosterone therapy? Of course, Dwayne. We do HCG. So all of we make sure that it's hormone replacement therapy, because Hormone replacement therapy, especially guys that are going testosterone, you need add-back therapy. Testicle, gonadal support. You don't want the boys to shrink. You don't want low semen production. You don't want tightness or uncomfortability in the testicles. So that's along with that, right along with an estrogen blocker to make sure you're not getting water retention, irritability, being sensitive, possible fat deposits, gynecomastia, man boobs. We don't want that. You want all the benefits with no negative side effects. And that's what we're here for. That's what we want to get you guys. Do you have doctors in New York for therapeutic phlebotomy? Yes. So if you're on a program with us, and this is crazy because, so New York, New Jersey, Rhode Island, so corporate medicine there is not practiced. So they have to be a licensed physician in these states to send you in for blood testing or therapeutic phlebotomies. So if you're on a program with us as far as testosterone, we can do therapeutic phlebotomies and send you in. We need current blood work as far as that goes to show that you do have that and stuff like that. That's how we do it. But yes, we can send you in all over the country for that. It's not a problem. Are there some injections that aren't required to see a practitioner? So no. Everything that we do here, therapy-wise, is prescribed. They all come from U.S. licensed pharmacies prescribed in your name. We don't sell any over-the-counter supplements or anything like that. Even though I might get into a line later that might help, and just some different things. I don't believe in pre-workouts and all these different things. A lot of bad things in there, but there are some different things that maybe we could produce in the future that might help people, like shampoos, DHT blockers, and stuff like that. But no. But it's real easy to become a patient, man. I mean, listen. Fill out the new patient paperwork. You see the medical provider in the comfort of your home on Skype or FaceTime, 10, 15 minutes, and you're done. It's over. Then you can order your therapies for a whole year and not have to see the medical provider. And at that point, it's very simple and easy. We make it real easy for you guys to do. We understand time is valuable. Things are going on out there. So we understand that, all right? Y'all get with Titan now. Best customer service ever. Kelly Lombardo. Thank you, Kelly. I appreciate that. I love seeing our patients on here, man. I really, really appreciate you guys all popping up on here. Makes me feel good. I'm very proud. So I'm happy to hear this. And our patient service and our therapies are number one to us. I mean, that's the main thing is our patients and how we can help them, make sure we take care of them, and, you know, we treat them like family. You guys are not numbers if you guys are patients. I think a lot of you guys know that. You might talk to me on the phone or Sharice on the phone or the manager or the staff or whatever it is, and they better come across like that. I mean, we are here for you guys. Ultimately, that's why we're here. We wouldn't be here if we didn't have you guys. So we appreciate that big time. Any other questions on there? And we're done?
New patient paperwork is up. We're ready to go. We got about 30 seconds. All
right, 30 seconds, guys. Hey, listen. Godiva is closing all its stores around the country. I hate that because I'm a big chocolate guy, right? The RAN and DYG. So initial fee, it just depends on what you're talking about. If it's blood work, it's $150 with a discount. It's usually $200. It's for the medical consultation for hormones. It's $150. That's every 6 months. If it's just a weight loss thing, it's $75 for the consultation. Okay? All right, so all Godivas are closing down. That sucks because I'm a big Godiva guy. I love that. I don't eat a lot of chocolate. That is the chocolate I will go with. I love it. So only online now, guys, which sucks because of COVID. So these guys are like, we're not going to do it. I can't believe it. Every store. Fauci, he wants 2 masks now. He wants people to wear 2 masks because it's more effective. What are we talking about here? We're talking about now people have to not wear 1 mask, but 2 masks. And listen, we're in the medical field, so we have N95s, surgical masks galore. I wear my Under Armour mask because I can't wear one with a ventilator on it. So even if I wear an N95 outside like a movie theater, they won't accept me. Even in Disney, because it has a ventilator on the outside. Well, that's an N95. So I wear this Under Armour one right now. We have masks here at Titan. Those have the ventilators on it. Because it's helping you breathe. I mean, it's hard to breathe in masks. Now, 2 masks you want us to put on? I mean, come on, man. This is getting a little out of hand, okay? I understand it might provide more protection. I do understand that. But it's going to be harder for people to breathe. People are cross-contaminating by touching their masks all day, adjusting their masks, touching this, touching that, pulling it off to eat, drink something, putting it back on. Dude, it's no good. I'm just telling you guys, it's no good, right? And, Fauci was the one saying before, we don't need masks. Masks are ineffective and all this stuff. Who do we believe? Now, listen, I knew even in the beginning, masks are effective. They are effective. That's why when doctors go into surgeries, dentists have them on their faces. It's to protect them and to protect you to to a certain extent, okay? So they are effective. How effective? I don't know as far as all the droplets and all this stuff. It shows some of the experience. We see some of the experiments, but it's just not good. Like the 2 masks, people are they're over the 1 mask. To put 2 on is going to be another problem, okay? So that's another one. Body positivity is good, but obesity is not healthy, guys. I see Cosmopolitan, they came out with this ad, and it's got obese women on it. It's like obesity is healthy. Obesity is not healthy, all right? This is a fact, okay? Now, if you're obese and you're overweight, please try to get the weight down as best you can. It's almost 50% of our population that are like this, and I feel for those people. I have a lot of friends that are in those situations, and they always ask me, hey, John, what do I do? And don't settle, Now, listen, don't be down on yourself, all right? Have the self-confidence, but don't be unrealistic, okay? Be in reality here. We want to make sure we're getting, if you're obese or you're overweight, losing weight. It doesn't have to be overnight, but progressively losing weight, doing healthier activities, lifestyle, having a better nutrition plan, guys. I hate to say diet, but have a nutritional plan that's together. Good foods, non-processed, activity, get good sleep, make sure hormones are balanced. Do those things, I promise you guys will be in the right direction. So, guys, I have to sign off. We have a little bit more to talk about. I appreciate you guys. So I'll see you guys Friday with Big Drew for Titan Lifestyle. Next Tuesday, I'm always here for you guys. Titan Talk Tuesday. I've been doing this for years. So I appreciate you guys all tuning in. It's great to have you guys. Thank you guys. I appreciate you guys. Guys, if you want to be patient, call or text 727-389-3220. You can also check out the website, www.titanmedicalcenter.com. All of our videos, from instructional videos on how to inject, our therapy videos, lifestyle videos. Go check out YouTube. Just search Titan Medical Center in the browser. Hit the all notifications button and become one of the great Titan Medical Center family. I appreciate you guys. Thank you. I'll see you next week on Titan Talk Tuesday, 6 p.m. Thanks, guys.